News Zoom room where Lieutenant Governor Josh Tenorio is standing by. Good morning, Lieutenant Governor.
Good morning, everybody, or good morning, everything.
We'll just go ahead and get started. You know, we had Gayleen Cruz on, and I'm sure you've been following this story. She's trying to get in as a caregiver for her husband, who's actually getting a limb amputated this morning in surgery at GRMC. She said she'd written to the governor, hadn't gotten a response, but she mentioned that she had written to you and you had written back. And so if you could tell us, is there anything being done to help Gayleen and people like her who are caregivers or need to get in to visit their loved ones as caregivers during this PCOR 1 lockdown?
Yeah, we communicate from time to time because I've known her professionally. She's one of our school leaders. But what I did was I asked the GRMC leadership if they could speak to her, screen her case, and figure out how they can make their accommodations given their infectious disease control policies. I didn't get any feedback from them, but I imagine it's because, I don't really know, or I'm not supposed to know what happens with the patient, but I advocated for it, and and just pray for her husband. I know she told me that he had some medical challenges, and that's top of her mind right now. Yeah. That's basically
how would you
no. Is there any discussions though on establishing what she's been calling for, a caregivers program?
Well, I mean, I'm obviously in favor of that, but remember that GRMC is privately run, so that's the only thing I could say. I guess there's a connection, I guess, and the connection she was making is that it's because we're in the PCOR 1 status, and that's what GRMC's policy is. But the only thing I could do is just see whether or not the hospital management thinks it's safe for her to be there. I don't know if we could mandate that in the private institution. I mean, I have to look at that further. Right. They do get some government funds through Medicaid and MIP patients, but I'm not so certain that that could reach in to dictate policy. But, I understand what she's going through, and it's our nature, and we want to be supportive. And, quite frankly, family patients recover well when they have the family support. And that's the big tragedy for the COVID patients who, because of the infection, cannot have access to their families. But in this regard, they're not in that situation. But I'm hopeful that they can figure out ways to make sure that that could be safe, but really it's a safety thing for them. They're trying to make sure that they contain any possibility of spread in their hospital.
Right. Josh, you said that, the government can't dictate policies for these private clinics and this hospital. But, back in March, I want to say, late February, the governor spoke before the Guam Medical Association, and I want to just run this video and this audio because it seemed like she kind of is in charge.
So if we declare a public health emergency, the governor has authority for everything. And so I can say to AMC, you are now under government authority, and this is what I want you to do, and this is how we're going to do it. I don't expect to be at that level of a public health emergency, but if we do declare a public health emergency, there is local legislation that allows me, I have authority to take money, I have authority to take property, I have authority to move personnel wherever I feel they are needed to be. So yes, we would have to, basically you have no say. No, you will provide the government, and we will work together, because I'm going to use your facility maybe for triaging or maybe for isolation, depending on what the case may be. That's the authority if we declare it a public health emergency. I will be a reasonable dictator. And fair. I will be your benevolent dictator.
Yeah, that's what she said to the Guam Medical Association. Do you recall that speech?
Well, I wasn't there, but I did recall the statements, and that was covered before. I'd say that the way I see the public health statute is it's really in response to the public health emergency. And so, for example, but I think the approach was, and I think the better approach is to work cooperatively with the private healthcare providers. But if we had a situation where we have to try and maybe get a ward or get a facility to treat COVID because it's a public health emergency, and go through a process of including, by the way, paying. The statute also says that whenever property or services are taken, there has to be fair, just compensation. It's not like you're going to be taking it for free, but I don't think you can use a public health emergency to tell a hospital to open for a for the non-COVID emergency. I mean, I think we can ask them to reconsider and maybe consider their policies, but like I said, for me, I would advocate, I'd ask them to take a look at it and look at it from and balance the humanitarian side with their responsibility to keep everybody safe and comply with the CMS rules and guidelines.
Right.
LT, I just wanted to ask, because we've seen instance after instance where you have people who are coming to Guam or coming home to the island because somebody in their family died or someone in their family is about to die. And it's very consistent what they say about the process. They say the government doesn't have any compassion. We heard it from the three sisters who came here to help bury their sister. We heard it from Marla Kitchell, who, sadly, she came back. Her mother is on her deathbed. She was told that in order to visit her mother, she had to take a COVID-19 test. While she was waiting for those test results, her mother died. Test came back negative. Then she was told by public health that that test was only so that she could go visit her mom in Naval Hospital. But they told her that, oh, now that your mom's dead, you don't need to go to the hospital anymore. So she's sitting in quarantine. I called her yesterday. She said that she was working with someone from the governor's office to try and get out early. But, I mean, obviously, there's precedent, and it's totally justified for people to say that the government of Guam and public health doesn't have any compassion. So how would you respond to that?
Well, I think that, I would say that is, I can see where they're coming from. I have two extended family members that died recently also, where I have family members that came in from off island that also had to go into quarantine and wait the time. One of them just got out right before his dad's funeral. But I would say that, yes, there should be some greater care and some compassion shown. And I think that that's something that we've asked public health to look at and to increase and maybe step up in terms of the authority, the officials that are looking at the requests. There always can be improvements. And I think that this is one area that there can be improvement, but the improvement has to be balanced with trying to contain the spread. But I think that the folks that are dealing with the hardship right now, I mean, I think that there could be and there should be some improvement, and I'll advocate that, and I'll talk. I know that we've been talking about that and asking them to improve their responsiveness and see how they can be. There could be a better balance in a humanitarian way.
We do have a comment here. My brother is admitted at GRMC. He is paralyzed from the waist down. His wife, too, like Gayleen, has asked to be a caregiver. It's understood that it's a safety issue. How do we know the nurses, doctor, and other staff are safe to come into work with no COVID exposure? Guidelines can be implemented for caregivers. This will help the staff. Some patients are reluctant to ask for help and are more comfortable with their caregivers.
Obviously, when you're sick, being with loved ones is going to help you. get better. That's no question. But I think comparing a caregiver to a doctor or nurse that is trained, remember that there's a lot of training that goes on. And although these folks sometimes, their infectious disease control procedures or even how they personally conduct may be slipping. We see that at the hospital at GMH, where there's been some nurses and doctors that have become positive, but their employee health division has to track that. I know that the hospital staff at GRMC is regularly screened. They have a screening strategy and a testing strategy. But, like I said, all we can do is try and advocate, ask them to take a look at it. They have their staffing issues. They're trying to make sure that they maintain the greatest number of medical professionals that can service. I'll just tell you right now, there is a record number of non-COVID admissions in the hospital. Part of it could be that people who have complicated health issues delayed seeing doctors, or because there was some, because the hospital priorities for people, they don't want to go into a place and risk being infected. But right now there's a record number of people in the hospital at GRMC, and they're going to have to make sure that their policies they have and are going to work for them to maintain their operation. But that doesn't mean I'll advocate. I'll ask their management to look at that and see how they're going to evolve this. But with the last few days, we had 65, 50. We had a plateau, and then there's been a little moderate increase in cases. I think that they're really probably being very conservative to try and figure out how to maintain their operation.
Wait,
Right.
so are you saying that the governor does not have the authority to tell
Tell them to open
GRMC
their doors and allow anybody to go in? No, I
to
don't think
establish
that
a
she can.
caregivers
I
program,
think she could
considering the
have
fact that
authority to tell them
it was
to
designated a
treat
non-COVID
COVID.
hospital through her executive order?
I don't believe so, Sabrina, and I don't
It
think
wasn't?
that we're go and tell hospital officials how they're going to run their operation. If we had to bring them online to try and get additional space to deal with patients, that's one thing. But to try and tell them to open their doors and maybe retreat on what their infectious disease policy is, I'm not so sure. I'll ask, but I'm not sure. And right now, if I was the governor, I would tell you that I wouldn't think that I'd have that authority. I'd advocate, and maybe I'll have my lawyers look at it, but I'm not so sure if I would be able to do that.
So based on what she said to the GMA, you don't think she has the authority?
I think she has the authority to get, you're asking two different things, Sabrina. One, I think she has the authority to go and compel private property and private healthcare providers to treat the patients that are dealing with the public health emergency. Does she have the power to go in and dictate the internal operations of a private healthcare provider? I do not believe so. I think it has to be very narrowly related to the public health emergency and treating the patients resulting from it. And but like I said, the better approach is to come to the table and explain the situation to the healthcare providers and ask them to help. And that's what they did eventually when they signed the executive order to get the cure on. That's what's happening right now with the dispatch of these testing machines out there at the health clinics. That's what's happening when we're subsidizing and telling private healthcare clinics to provide free COVID testing that the government of Guam is going to subsidize and pay for. Those are the kinds of things I think that the governor can tell the private healthcare providers to do, but it always has to be related to responding and dealing with the public health emergency. I don't believe the governor can tell a private health clinic to expand their operation and have more cardiac patients. I don't think she can go and tell them that they should open 24 hours instead of 10. That being said, if there's a need to try and get them on to try and deal with a crisis situation, even bigger crisis than what we're dealing with, that's another thing. But I think that there would be a structured way to get the services. I don't think it's carte blanche the way that we're comparing it.
Right,
And
yeah. I think though, LT, to be fair, that's the way the governor made it sound. I mean, she was pretty clear. But
but
I mean, all we can do,
Chris,
LT, is
I don't think what she said back then is what she has done leading up to this
Right.
situation we're in. I think the alternative and the better path is to working collaboratively with the private healthcare providers.
but I mean, at least we could hope is that you would advocate and ask. And I mean, GRMC is kind of run by the campaign chair for Lou and Josh, so I know that there's that connection. And
I know, but that's
I know.
not fair. You don't use politics to go and run a hospital. That's not
No,
true.
no, I'm not saying that,
If
you
that
know.
was true, Chris, then we can go in free access and go into wards. That's not true.
No, I'm not saying that.
Because people get involved in campaigns or politics doesn't mean that the politics is going
Right,
to
right,
dictate
right.
how they run their private
I'm not
business.
saying that, LT. I'm just saying that there's an obvious relationship that, you know, I mean, Guam is like, hey, I'm not saying that you're going to go and say, oh, because we ran the campaign, do what we say. I
No, but
understand
Chris,
that.
And on that front, yes, I would ask,
Yeah.
please take a look at that from a compassionate, and I did. Immediately when Galen sent me the message, I made a phone call and I asked them to please, I'm advocating, I'm not what sure your policy is. I'm hopeful that you can find a way that she can go in and take care of her husband.
Right.
But I can't say, hey, can you, you know,
Yeah. No.
when there are rules, it has to be applied the same way. Even in quarantine, my own executive assistant was in quarantine at the Dusit. You know, people were surprised, oh, couldn't you get her out? No, she has to follow the same process as everybody. And that's what the situation is.
Can we move along to the governor's announcement this week that there wouldn't be any further easing of restrictions? And with that being said, and like you said, we've seen the positives. I mean, it's so tragic. The deaths keep coming. The numbers aren't coming down.
There's going to be another one announced soon. You'll be getting a JIC. I just got word that there's another one that will be coming out of one younger than us, and they'll be making the announcement as soon as they confirm that the next of kin is notified. But there's another one, Chris, that I just got word of that's younger than us.
Wow. But yeah,
GMH or at GMH?
You know what? I'm not sure. I just was notified there's an additional one.
LT, so we're not easing any further restrictions, but on the flip side, seeing as how we haven't had the numbers come down, the hospitalizations, I mean, huge spike over the last couple of days. Are we anticipating any tightening of restrictions?
I'm not sure yet. I hope not. You know, I mean, I think that I'm not sure if our public would be able to deal with that, quite frankly.
Yeah.
I mean, we're seeing here in Guam, just like we're seeing in the country, there's COVID fatigue, you know, at trying to make sure people are as compliant as possible, and trying to push in more resources. I'll tell you this, public health needs additional help. And right now we're identifying and sending the help in because of all these additional cases, and including, Chris, you know, some of the items that you pointed out. The big item is trying to make sure that the right people are responsive and are compassionate when people have situations. I want public health to be looking at individual cases and not be overwhelmed where they're looking at people as numbers. And that's a big thing that I'm really looking forward to getting them more resources. It's happening right now to try and get them to do better, because they can do better. They can do better on different fronts, including in fronts that are non-COVID related, like child CPS. Right now, I tell you, I'm looking at CPS. I've asked for a review on what's going on with the case at at the Global Dorm, you know, and I think that a couple months ago, during our Homeless Coalition meeting, we revealed that there needs to be a bit more attention going on down there, more quality casework, because it's not to my how would you say, my
Standard?
expectation,
Right.
you know, what you think should. So, and then on the other side of it is also, you know, public health is responsible for senior citizens. So it's a big department. The number one priority, obviously, is the COVID response, but there are other areas in that department that require additional attention And the last few days, and including now and going into the next few days, it's going to be about pushing in more resources and also activating some of the partnerships in the community to expand the contact tracing and expand testing. That's the other thing. You know, we're seeing we need to go in and be a bit more on the offense on the COVID rather than be on the defense. And I think that's what you're going to be seeing some movement on in the next few days, and actually in the last few days too.
Josh, I wanted to follow up real quickly because I know the OHAP meeting, I think it's today, but we
Yes,
had Diana Calvo on yesterday, and she was talking about how they're starting to see new faces, new homeless people, and maybe if you have any numbers on that, and also, are we going to see another shelter open?
We are going to see another shelter. I was hopeful that we can have an announcement today for it, but still going through the review and inspection. But I'll tell you the big thing, Sabrina, is the vast number of children there. You know, we have 14 infants up there. 3 of them, Diana told me yesterday, are under 2 months old. And the fact that we're in this situation with such a large amount of children up there. I had a meeting yesterday with actually I had 3 different efforts trying to push on different fronts. The first one was making sure that we strengthen the response to the global dorm. The second one has to do with making sure that we can get the Sister Bridget Regalo home open in Barrigada Heights because of the need. And the third one has to do with examining CPS and their response, not only to the case that was in the paper, but their ability to make sure to address the needs of kids. I had a meeting with DYA and behavioral health yesterday about all the different placement demands that are happening with all the children, especially teens that are harder to place and that are suffering out there. So it is, there's a lot of work to be done. And I'm personally pressuring and making sure that we try and catch up, because the way I see it is the system is not operating. It hasn't been operating for a long time. I saw it at the court. It's not operating at the place where we need it to be. And I think that's, for me, that's one of the motivations I have in addressing the homeless situation, but in particular, focusing on the needs of the kids and the infants, a lot of infants. And by the way, if you have donations, bring them to the main call Catholic Social Services. Don't bring them to the dorm directly, because it kind of causes a little disruption there.
Right.
They'll be able to try and make the connections, and there is a need. There is a need, especially for the kids up there.
Josh, what seems to be though I guess the biggest problem with securing the shelters? Is it just that nobody wants to have a shelter in their neighborhood?
Yeah, so some of it, or the people that are offering are overcharging. You know, some of them price per motel room is going to be the same price as a hotel room at the Hyatt. I mean, it just is downright embarrassing. And so part of it is that, and also making sure that in the outreach, and I'll tell you that the outreach that Catholic Social Service is doing as part of this effort is leading to some success. We're identifying more people that are willing now to come in. There are some people that were resisting several months ago. So part of it is location. We had a lead to try and maybe have another location in Barrigada, but the group that's in Tamuning and Tuman, that location they weren't going to move because it was away from some of their support systems, and some of them actually even had jobs. So focusing in on Tamuning, I have a lead in Tamuning, trying to figure out how to and get it done. It's under inspection and making sure that safety is being used. I'm optimistic that we'll be able to get another one over there. That's there. No question, Sabrina. We have to have one. It's not we have to have one.
Right.
No question.
LT, the Archdiocese and the Catholic cemeteries came out with a joint statement with the private cemeteries at All Souls Day, and I think a couple of days before they're going to close them off, right? So, are we anticipating that same kind of thing happening with the public cemeteries under the government of Guam?
You know what? I don't know yet. I would think that we would align with that policy. And it's not only it's even the veteran cemetery. My
Right.
dad's there. Usually go to mass there. By the way, I always wonder I think mass usually is there at 1 o'clock. I think 12
Hot.
or 1. It's like
The hottest
time. I thought to myself, what? This is anyways. I'll take a look at that. Likely we're going to align in that, and usually, Chris, it's because even in the public cemeteries and veteran cemetery, we rely on the Catholic parishes to perform the ceremonies.
Right.
So I would say that we're likely to align with that, but we haven't. The decision-making process hasn't completed on that.
Hey, earlier you talked about when I asked you if we were going to tighten any more restrictions, you said that the public couldn't handle it, and obviously there's always backlash for everything that gets done during this pandemic. But does that hamper at all the ability? Because we had Dr. Hoa on yesterday, and he had said a few times that the only thing that would work right now to get these numbers down would be to do a strict, like, real PCOR 1 lockdown. He said that's what would work, but that's not what we're going to do because people just freak out.
And unfortunately, part of it is there's no teeth. So, like if you see in state of New York, state of Hawaii, there are some civil penalties that act as a disincentive for folks. But the real thing right now, the spread, they get it at work, they come home, and it's a lot of the people younger than us, they unintentionally give it to their elders, then they go to their friend's house, barbecue, sleep over, and it's spreading like that. And it's the human behavior. I'm not sure if the fatigue, people are indifferent because maybe some people had it and they didn't have strong enough symptoms and they think they're invincible, but they're really spreading it. We have to try and reach them and do different ways to try and reach them. I mean, I have to tell you guys, your station has been doing great, consistent messaging on this, but we need to, it's kind of like trying to follow that path and even penetrate the community more. And try and understand how we can reach them in the social platforms and the messaging that appeals to them. Because somebody was saying, hey, a lot of young people, they don't realize they're the big spreaders. I said, well, it's in the information we release. They're not reading it. I guess we're living in Twitter world where you can 144 characters, right? Very brief. And it's trying to crack that nut and trying to figure out how we can reach them. You guys, to be honest with you, the media, but in particular your station, because you've been very proactive with all the talent and on all your platforms moving the message. I mean, that's been effective. Try and figure out how we penetrate it even more. And Sabrina and Chris, can I just drop an idea and maybe ask you guys in the station Halloween's coming up, and I'm not sure, and I'm hopeful you guys usually are the creative ones. I don't know if there's some way on your digital platforms that you can try and figure out, you might already have this in your plan, how to try and do some alternatives on Halloween that would allow, people to be happy. And, I don't know if it's a costume contest on Zoom. I have no idea.
We're working on it.
Yeah.
Don't worry. We're working on it.
Yeah, we're working on it.
Can we sign up and partner with you on this? Because I am concerned, even in my neighborhood chat, people are talking, hey, we're going to have something. And I'm thinking, don't have something. Words are like, to hang something on the, we only have 12 kids on the street, so they're
Right.
going to hang something on the gate. I mean, what are the creative ways that people can, still be spirited?
Right.
And, we don't have all the answers, and we're not as creative as some of the talent you have, but there are ways, that what you're thinking, I'd love to be part of that and try and see what we can do to support it. I mean,
Okay.
no matter what, we are in this all together, and I appreciate the opportunity to come on, answer questions that are friendly, answer questions that are not. That's just that's what we have to do.
Amen.
Right.
Yeah. So what are you going to be for Halloween? Because I'm thinking just baseline. Let's all just dress up, right? I mean, we can rot in our mouth and we'll figure that part out. But it's really
I'm
just
not
about dressing
sure.
up with a costume, right? So
That's what, can I just tell you, I never really was, even growing up, I don't know why I really wasn't dressed up for the Halloween. I may have like 4 times. I got scared, but I'm willing to consider, I don't know, I have to give it some thought. Obviously, I've been watching the national politics and the situation. Maybe I'll do something on that front.
right.
I
on.
don't know.
Well, thanks, LT, for coming on, and thank you again for your kind words.
Thank you.
No, thank you so much. Appreciate the opportunity. And, to the folks that are in the situations, and, I tell you, when you're dealing with a death or people are sick and you feel helpless, it is a big thing. And, I'll do my best to try and see how we can help, and given the balance that needs to be there. But, we have to figure out how we could be helpful. And that's always kind of been that's what I think about.
Well, at the end of the day, all we can do is ask that you do your best, LT.
Yep.
So thank you.
That's right. I appreciate that.
Yeah.
Thank
Okay.
you so much.
Okay, LT.
Take care.
Lieutenant Governor Josh Tenorio. Wash your hands. 8:50. We will take a really